everybody to the final review exam for 166. And go ahead and make sure you guys are muted if you just got on. Anyways, this is the 160 or the 166 final exam review. We're recording this so I can send this out to students that aren't able to make it. So if you guys would just give me a hand and let people in that come in the lobby, we are going to go ahead and get started. There are 81 questions in this deck. I want you to put in your answer in chat, and we will go through each of those. If you have questions along the way, feel free to stop me and we can discuss it. Partway through the deck, there are some math questions. So if you want to have a piece of paper and pencil ready, there's some practice math questions. And we will move this along. All righty. So the first question, a woman comes in pregnant. She's previously delivered at 34 weeks and had a 14-week loss. What is her GT, Paul? Go ahead and figure out your answer. And once I see, we've got quite a few answers in there, I will bring up the answer for you. Remember that GT, Paul, stands for gravida, term, preterm, abortion, and living. Gravida is anytime a woman becomes pregnant, including her current pregnancy. Term means that they've made it to a 36-week gestation. Preterm is any delivery between 20 and 36 weeks, 6 days. And then the abortion is anything before 20 weeks. So with that, the answer to this question is A. So she's been pregnant 3 times. So that leaves it to A or C. She has not had any term deliveries. She has had 1 preterm delivery at 34 weeks, and then she had a 14-week loss. So that makes A the correct answer. She has no living children at this point, or no? It doesn't say if that 34-weeker lived. So I think this is a confusing question, but keep in mind, if that 34-weeker had lived, I think this question is assuming that the 34-weeker did not live. So that would mean that living would be 0. If that 34-weeker had lived, then the living would be 1. But this question doesn't really explain that. So, all right. Go on to the next question. During the first 4 hours postpartum, which findings are normal? Select all that apply. The answer is A and B. So A firm midline uterus is normal 4 hours after delivery. If the uterus is off to one side or the other, that means that she has a full bladder and it increases her risk for hemorrhage. But a firm midline uterus is normal. Lochia ruba is also normal. That bright red bleeding after delivery. Yes, I am planning on sending this recording out. I think I have it figured out. So, all right. So, um, let's go to the next one. To relieve perinatal bruising and edema after delivery, the nurse should do what? What should the nurse do in this case? The picture is a hint. So if you think through this, ice packs decrease swelling. You would never apply a warm pack to someplace that just had trauma because warmth increases bleeding. You wouldn't give it aspirin either because that would increase bleeding. And you wouldn't leave her sit in pads unchanged. So the answer to this question is A, because ice reduces swelling in the first 12 to 24 hours. All right, so the A in Rita stands for what? What does the A stand for? A stands for approximation. So Rita is redness, edema, ecchymosis, discharge, and approximation. Righty. The age of viability is what? See a lot of A's. The answer is A. Viability begins at 20 weeks. So question 6, nutrients especially important in pregnancy include what? Select all that apply on this one. I don't like select all questions either. So, but I think they're good practice. See a couple people have an answer. And the answer is A, B, C, and D. So the rationale, the nutrients that a pregnant woman needs is iron, calcium, protein, and folic acid. Those are the key nutrients. Next question. Suturing an incompetent cervix is called what? When an incompetent cervix is sutured, what is that called? The answer is A, is a cerclage, and it prevents pregnancy loss if somebody has cervical insufficiency. All right, next question. Pregnancy sleep teaching includes what? Which of these items is something you would teach a pregnant woman? And the answer is C. And that is because it prevents vena cava compression. So you don't want a pregnant woman to lay flat on their back. Question 9. Non-pharmacologic pain relief in latent labor includes what? Select all that apply. Non-pharmacologic. The answers A, B, and E. So the pudendal block and the Nublain are both, they both involve medications, but you could do sacral pressure, distraction, and relaxation and breathing. All right. Bulging fontanelles may indicate what? Bulging fontanelles can indicate increased cranial pressure. So that's the answer is A, hydrocephalus. Okay, next question. Most severe, which is the most severe spina bifida? Which is the most severe spina bifida? The answer is C, myelomeningocele, because that exposes the nerve tissue. Cleft palate infants are at risk for all except for what? Cleft palate infants are at risk for all except for what? The answer is D. Thermoregulation is not specifically impacted. Doesn't mean that they couldn't have a separate problem, but it's not necessarily associated with the cleft palate. Question 13. High bilirubin can cause what? What are we concerned about with high bilirubin? Seeing lots of the here. The answer is C, kernicterus. Because what happens with kernicterus, that bilirubin goes into the brain and causes brain damage, and that's what kernicterus is. Question 16. Latchkey children should what? What should latchkey children do? And I don't remember specifically talking about this in lecture, so. But what should latchkey children do? And the answer is A and D. And this didn't say choose all that apply, but they should never let strangers in, and they should know how to reach a trusted adult. So it's about them being safe. Question 17. Which child to assess first? Out of these questions, which child would you assess first? And just for your information, these sorts of questions where you have to prioritize are often seen on NCLEX. So the answer is C, pneumonia, the respiratory rate of 28. That is high. And whenever you have somebody that has a breathing problem, then that is always the priority. There are 100 questions on the final. Okay, next question. PACE mnemonic refers to what? What does PACE refer to? The answer is A, and this is the PACE is the scale for the adolescent risk assessment. So I feel like that it does not look like how it did in our lecture, but remember PACE was like parents, POTS, I don't like this question. I'm going to throw it out. But
Parents, peers, alcohol,
parents,
cigarettes, and environment.
Very good. It was out of my brain there for a second. Thank you. Ignore this slide. I don't like this question. So, all right. Question 19. Oral medication administration. This is multiple choice. Which phrasing is the most appropriate when administering an oral medication to a young child? How would you phrase this? What is the best way to approach it? So the answer is C, offering a choice after the medication promotes autonomy and without manipulation. And you don't ever want to refer to medication as candy. That becomes unsafe. All right, question 12 or 20, excuse me. It's been a long day already. I'm sorry. Match the developmental term with the correct definition. So like you would put 1 and then the letter after it 2 and then the letter after it 3 and then the letter after it. So take a moment and connect those terms with the definition. Okay. So the answers, 1 is B. So cognitive development is thinking and reasoning abilities. 2, cephalocaudal growth is C, and that is growth from head downward. And then 3, adaptive development. That is A, that's skills that allow independence. And then 4 is proximal distal growth, which is D, growth from the body center outward. There's a couple that are set up like that. All right. So, child nutrition, this is multiple choice. Which is not a feature of a well-nourished child? So, make sure that you always pay attention to if there's a not or except in there. So, when you read a question, make sure you know what it's looking for. So, which is not a feature of a well-nourished child? So the answer is the mouth sores. Sores indicate a nutritional deficiency or illness. So um, improved muscle tone, um, steady gains in weight, and an abdomen that's flat and firm. Um, and I do understand where you might be confused by the flat and firm, but children do usually have firm bellies, but they're not distended. So, and then question 22, enuresis. Secondary enuresis is defined as what? All right. This is something I don't remember being in the lecture once again, so I'm glad that we're reviewing this here. But secondary enuresis follows a period of established continence. So, they were wetting the bed and then they were dry for a period of time and then started again. It's a little bit of a regression. I guess we did talk about bedwetting and regression, but that's what secondary enuresis is. And then injection pain reduction, multiple choice. Which intervention does not reduce injection related pain? We talked about several different things that we wanted to do to reduce the pain. Which one does not reduce the pain? A lot of people getting the right answer. So we want to do a quick insertion that reduces pain, but a slow insertion would worsen pain. And then hydroform mole, which pregnancy findings support a suspected molar pregnancy? And this is a select all that applies. Okay. So the answer is A, C, D, and E. So a larger than gestational age uterus, um, snowstorm pattern on the ultrasound, elevated HCG, and signs of hyperemesis. So the mole is an abnormal trophoblastic growth causing high HCG, vomiting, and abnormal ultrasounds. Question 25. Painless bright red bleeding. A patient at 32 weeks with painless bright red bleeding is most likely experiencing what? Painless bright red bleeding. Okay. So the answer to painless bright red bleeding is placenta previa. If it had pain and you had bleeding, it would be placental abruption. So painless, bright red bleeding is placenta previa. Painful, dark red bleeding. So a pregnant patient with abdominal rigidity and dark red bleeding is most likely experiencing what? And I did just talk about that in the slide previous, but the answer is abruption. So placenta abruption is a darker red bleeding with pain. Okay, so this next one is on preeclampsia. A pregnant patient with a sudden weight gain, blood pressure of 155/98, proteinuria, headache, and vision changes is experiencing what? And the answer is this is a triad for preeclampsia: increased blood pressure, protein in the urine, plus symptoms, headache, swelling, vision. The answer is preeclampsia, B. Question 28. Rh negative clients receive RhoGAM at what, or when did they receive RhoGAM? They receive it at 28 weeks, and that's just the standard for anybody with negative. And then that mom, especially if her baby is positive, would receive the RhoGAM within 72 hours of delivery. So 28 weeks and after delivery. RH isoimmunization, maternal formation of anti-RH antibodies after exposure to fetal RH positive blood is called what? And the answer is isoimmunization. Can you tell that AI helped me write these questions? That one needs corrected. Question 30. The 4 P's in labor. Labor process is influenced by what 4 P's? Seeing a lot of people get the right answer. The answer is A, powers, passenger, passage, and psyche. I've got a puppy that's trying to join me up here. All right. All right, next question, 31. Contraction frequency. How is contraction frequency measured? How do we measure frequency? So frequency of the contraction is measured by C, from the start of one contraction to the end of the next contraction. Now, if we look at the start of one contraction to the end of the same contraction, that's duration. That's how long it lasts. And then the time in between the contractions is the interval. So that's like the time in between. And I think that was on one of the tests before. All right. So I put the veal chop acronym there on the right. So this is another matching question. So you can just put like 1, 2, 3, 4 for the early, late D cells, and then put which thing it goes with after. So when you look at this, you know, the E for the early D cells is head compression. So it'd be 1 and B. Late D cells, looking at the bottom, late D cells is placental insufficiency. So you have, it should be 2C. And then variable D cells, which is at the top, variable D cells go with cord compression. And then accelerations are normal and reassuring. So make the answer come up. So there's your correct answers. Good job. Next question. Make sure you review this veal chop. I don't know how many questions are on this, but usually there's more than one. So next question. What does Leopold's maneuver assess? What does Leopold's maneuver assess? The correct answer is C. With Leopold's maneuver, we're assessing for fetal position and presentation. So is the head down? And what way is the baby facing? That's what we're looking at when we do that, or palpating for, rather. Question 34, end of first stage of labor. The first stage of labor ends when the cervix is what? If you're just coming in, make sure you're on mute, guys. Make sure you're on mute. All right. So the answer to this one is C, 10 centimeters. So that's the end of the first stage of labor, is at 10 centimeters. Then they're going to start pushing. What are some of the contraindications of induction? Select all that apply. What would you not, which people would not be induced? All right. Seeing some ABCs. So looking at these answers, breech presentation, that's a no-go for induction. A previous classical C-section, most of the time, if you have a vertical, which is the classical in C-section, they will not induce you. If you have like the panty line incision, they will VBAC, but you have to be in the appropriate facility for that. And then an active herpes case, somebody with herpes outbreak would also not be induced. Ruptured, this AI had put the answer as D, but ruptured membranes at zero station, technically, I would not say that's a contraindication. I don't agree with that answer at all, as far as D, but A, B, and C for sure. And cephalic presentation just means that the baby's head is down, so that is how we want them to be. So the answer to this one should be A, B, C. I'll have to go back and redo this slide after these closer looks. I really put a lot of time into putting these together, but didn't check them as close as I should have, for sure. All right, so risk for cord prolapse. What is the highest risk for a cord prolapse? What do you guys think? Okay. We're going to talk through this one a little bit. The answer is A. And that's rupture of membranes when the baby is still that high, leaves space for the cord to come down before the head. And that's why the answer is A on this. The rest of these ruptured membranes at zero station, the baby's head is down at the ischial spines. And so there's not as much room for the cord to come through when those membranes rupture. Breech presentation during pushing, that's not really a risk for cord prolapse. It's when you have that space in between the head that allows the cord to come down. So the answer to this one is the -3 station. Rupture of membranes when the head is up above the ischial spine. And then medication to accelerate fetal lung maturity. What do we give to moms if they're threatening preterm labor to help develop the baby's lungs? The answer is B, betamethasone. So a steroid helps to develop the baby's lungs. And then cause of late postpartum hemorrhage. What is a cause for late postpartum hemorrhage? Okay. And the answer to this is B, retained placenta fragments. That's when the mom goes home and she's still having a lot of problems with bleeding. Sometimes those moms have to come back to have a D&C if they have retained placenta. All right, question 39. Breastfeeding and cramps. Cramping during breastfeeding occurs because why? What causes the cramping during breastfeeding? The answer is B, oxytocin release. So stimulating the nipples, reduce oxytocin. It was interesting. I just met with a OBGYN this last week or so, And we were suggesting that he order the breast pump during the second trimester. And he said, no, he won't. And the reason is sometimes women will use them to try to induce labor. So he won't give it to them until towards the end of labor, the order for the breast pump, which I thought was interesting. Breastfeeding education, select all that apply. Which things would you teach to a breastfeeding mom? Which things would you teach to a breastfeeding mom? Okay. The answer is A, B, D, and E. And just to do a little bit of clarification on this question, the feeding every 2 to 3 hours, the rooting reflex, that's a good thing that helps the baby get latched. D, infants should take the entire areola. I think it sounds odd, but honestly, what that means is you don't want the baby directly on the nipple. You want them on the all the way on the areola. That keeps the nipples from getting a sore. And then alternating breast is another thing that we do teach them. All right, next question. This is preventing evaporation heat loss. A mother shows understanding of evaporation by what? What would the mom say that would let you know she understood it? So the answer is A. So evaporation is the heat loss with the moisture. And so making sure the baby is dry after a bath would show that she understands how to prevent evaporation heat loss. Question 43. Priority action for a jittery newborn. What would the priority action be if you have a jittery baby? And the answer is check glucose because being jittery for a newborn is a sign of hypoglycemia. Question 44. We're more than halfway there, guys. There's 81 questions, I believe. So, question 44. Which newborn finding is not normal? Which newborn finding is not normal? Okay. The answer is D. No head leg. All righty. So, Vernix explanation. What is the best response to teach the mom about the vernix? Okay. So vernix is that white, cheesy substance that's on the baby's skin, it protects their skin when they're in the water in the uterus. And so the answer is A, it's normal and it protects the skin. Newborn development. Which statement reflects correct understanding of newborn development? So the answer is C. Baby walks around 12 months. But I mean, that is, there's obviously, you can see babies walk as early as like 9 months, and some may be a little bit slower. But in generally, babies are walking around 9 months. Rolling over is generally earlier than 9 months, and imitates, babies don't imitate at 1 month old, and solid food at 3 months is too soon. So I was just reading what she said about wiping the vernix. I mean, generally they teach them to leave the vernix in place and not wash it off, but um, yeah, I'm not sure on that one where that was written, but the vernix is skin protecting. All right, so the developmental theorist that has 4 stages of cognitive development, which one is it? And this is actually a picture of Piaget here. So the answer is Piaget. So teeth in a 15-month-old. How many teeth should a 15-month-old have? And then bonus points if you put in the formula that you're supposed to use for that. The answer is C. They should have about 12 teeth.
How you do the math on the teeth again?
I'm trying to remember.
Oh.
It's 6 months. You look at their total months, and the formula was the age in months minus 6. That's what it was. She's got it right. I was trying to think of what the formula was. There's different ways to look at that, but it's the age in months minus 6.
15 minus 6 is not
15
12.
minus 6 is 11.
Okay,
But
so maybe it's
teeth
just a
are
typo.
usually, well, I don't think it's a typo because teeth usually come in pairs. So it's going to be an even number.
Okay. Okay.
So the closest number, but it is the age in months minus 6. Maternal immunity duration, which, and I think this is referring to how long the immunity lasts in the baby from the mom after delivery. The answer is B, 3 months. Okay, so trach care supplies. What are all part of trach care supplies except for what? So the answer to that is okay, I don't like this question either. Um, yeah, I don't like this question. I don't know why you would want a larger size trach or why you wouldn't want the same size trach. That's two questions I need to remove from this deck, guys. I'm sorry. All right, so there's a math question up here. I'll give you guys a few minutes to solve the math, and then we'll look at that. Once I start seeing some question or some answers come in there, then I'll look at the review. I see three people that say this is a safe dose. All right, let's look at the answer here. So first, it's going to tell you how to calculate it. So to calculate the safe daily range, first you got to take the 20 milligrams per kilograms um, and times that by the kilograms, which is 22.7. And so the low dose for the day is 454 milligrams per day. Then the high end is 40 milligrams per kilogram times 22.7. And so the high range for the day would be 908. And then you got to look at the ordered total daily dose. So 600 milligrams times three doses is 1800 milligrams per day. So that is not a safe dose. So the range for a safe dose of not being too low and not being too high is between 454 milligrams per day, and you do not want to go over 908 milligrams per day. So the amount ordered was 1800 milligrams per day. So that means this dose was not safe. This is a weight-based medication question, so go ahead and figure that one out, and then we will review. Give you another minute or so, or I'm starting to see people put answers in now. All right. So the first step in calculating this is to take the 0.12 milligrams per kilograms and multiply that by the kilograms. The child weighs 19.5 kilograms, and that equals 2.34 milligrams. And then you've got to convert the milligrams to mLs using the supply concentration. So you have 4 milligrams per 5 mLs. You want to solve for 2.34 milligrams per X mLs. So you have to take that 2.34 milligrams, multiply that by the 5 mLs. And the answer to this is 2.93 milliliters. And then you do round that to the nearest tenth so that the people that answered 2.9 milliliters was correct. Just remember to put your mLs after it when you're putting it on the test. So good job, guys. Another math question, and this is mLs per dose. You have an order for ampicillin, 275 milligrams IV. You have 500 milligrams per 10 mLs. How many mLs will you draw up? Okay. So for this one, you're solving for X mLs, and you have to take the 275 milligrams times the mLs and divide that by 500 milligrams, and that equals 5.5 mLs. Good job. So the correct dose is 5.5 mLs. So just wanted to give you guys a little bit of review on the math because there will be math questions. All right, so this one is concentrating and rounding to the tenths. So the provider orders hepatitis B vaccine of 10 mcgs IM. The vial contains 40 mcgs per ml. How many mLs will you administer? Oops, I almost made the answer come up. Now, keep in mind when you're doing this that you only want 10 mcgs. And if you look at this, 10 mcgs is 1/4 of 40 mcgs, right? So you can kind of look at that right off the bat and know that you want it to be less than 1 ml. And it's 1/4 of that, but we'll go through the actual way this was solved. So step by step, 1 ml equals 40 mcgs. You want 10 mcgs. So you're solving for X mLs. So you have to take the 10, multiply by 1, and divide by 40. So you're going to be administering 0.025 mLs. So in this question, you would round to the nearest tenth, which was the point. This was the whole reason this was in here. So you're round to the nearest tenth. So the correct dose is actually 0.3 mLs. All right, next. This one is converting pounds to kilograms plus dose. So you have a toddler that's 30 pounds. The provider orders ibuprofen at 10 milligrams per kilogram, and the concentration is 100 milligrams per 5 mL. So how many mLs will you give this child? And remember, you got to convert the weight to kilograms. Let's kind of go through this kind of slowly. So the first thing you do is you convert that 30 pounds to kilograms, and you do that by dividing by 2.2. So then you have 13.64 kilograms. The next step is to calculate the milligram dose. So now you need 10 milligrams per kilogram, and you're going to multiply that by 13.64 kilograms. That gives you 136.4 milligrams. Then step 3 is you're going to convert the milligrams to mLs. You do that by taking 100 milligrams per 5 mLs. You want 136.4 milligrams per X. So right off the bat, you know this is going to be more than 5 mLs. So you're going to take the 136.4, multiply it by 5, and divide it by 100, and you get 6.82 milliliters. And when you round that to the 10th, you're going to be at 6.8 mLs. So good job. The correct dose is 6.8 mLs. All right, so back on off of math questions, we're going back to regular questions. So this is question 55. So kick counts. A healthy fetus moves how often? Correct answer is B, 10 times in an hour. So when you tell them to count kick counts, usually I'll tell them, to eat something, lay down on your left side, and count how many times they kick over the hour. So 10 times over an hour. So the gynecoid pelvis, which of the answers describes what a gyneco pelvis is? All right. Answer is C. So it's a round, most favorable for childbirth pelvis. Always remember that because it starts with a GYN. All right, question 57. Gestational diabetes screening timing. When do we do that? Which is the best answer down there? The answer is C, 24 to 28 weeks. Torch infections. Select all that apply. Which are considered torch infections? It's A, B, and C. So definitely review torch infections. Good job. Hyperemesis medication. What type of medication would you give to somebody that has hyperemesis? Answer is C, antiemetic. So that's anti-nausea vomiting medication is an antiemetic. Um, Implantation outside the uterus. If you have a pregnancy that's implanted outside the uterus, what is that? The answer is A, ectopic pregnancy. Select all that apply. Impending signs of labor. A, B, C, and E. Bloody show, rupture of membranes, a burst of energy, and weight loss. Impending signs of labor. The cardinal movements are the movements that the baby makes as they're being born. Which is the right set? A or B? The correct order. All right. The answer is A. The cardinal movements of labor occur in this specific order as the fetus navigates the maternal pelvis, allowing the head to align, rotate, and pass through the birth canal effectively for a vaginal delivery. So engagement, descent, flexion, internal rotation, extension, external rotation, and expulsion. When to call a provider postpartum? Which statement indicates a misunderstanding? A is call if you have a fever of greater than 100.4, call if you have a foul smelling lochia, call if you have prolonged depression, or call to report breastfeeding success. The answer is D. The rest of them you would call the doctor for. You don't have to call the doctor to let them know that you're having success at breastfeeding. Uterus deviated to the right. What does that mean? Or what would you want to do? So uterus is deviated to the right. The answer is B, help the patient void, whether they're getting up to the bathroom or using the bedpan. A uterus that is deviated one direction or another just means they have a full bladder. As long as the uterus is firm and they're not bleeding, they don't need a uterus massage, but they just need to void. Medications for postpartum hemorrhage. Select all that apply. What medications can be given for a postpartum hemorrhage? Okay. The answers are B, C, and D. Oxytocin, hemabate, and methergin are the three medications that could be given for postpartum hemorrhage. So, what is the time that we do the APGARs? The answer is 1 and 5 minutes, A. Good job. Um, what is a normal finding in a male, a male baby? What is normal? Okay, so out of these answers, the answer is C. The testes are generally descended in a full-term baby. Hypospadias or epispadias is when the urethra is either on the top or the bottom of the penis, and hydrocele would not be normal either. So in this answer, the answer is testes are descended. Question 68, the umbilical cord vessels. What, how many arteries and veins are in the umbilical cord? So an umbilical cord has two arteries and one vein. The answer is B. So, and they are actually opposite as what they are in the adult body. The in so I always get confused, but the arteries are smaller and there's two of them, and the vein is the larger one. So question 69, when should solid foods be introduced to an infant? And the answer is B, 4 to 6 months. So keep in mind that we introduce them between 4 and 6 months when the baby's able to sit up, control. They do the tongue thrust. They have the tongue thrust reflex. Um, and you introduce one new food at a time. So, question 70. Which are, these are the diabetes triad. Which goes to which one? You can just put them in order. Which is polyphagia, which is polydipsia, and which is polyuria? Okay. So polyphagia is excessive eating. Polydipsia is excessive thirst, and polyuria is excessive urine. Those are the triads for diabetes, the three things that you watch for. This is the gestational age tool. What is the name of it? Which one is it? Which tool do we use to figure out gestational age? The answer is A, Ballard score. So this is done usually shortly after birth, and there's points given depending on where the baby falls for each of these categories. It's totaled up and it gives you an estimated. This isn't the full form. I just put a brief um, just to trigger some memory there. But it's the gestational age tool is the Ballard score. And then what does the NST evaluate? Keep in mind the NST is when we put the mom on the monitor. We watch her for at least 20 minutes. We're watching to make sure she's having accelerations. What are we evaluating when we do that? And we are evaluating fetal oxygenation. When the baby is able to bring their heart rate up and down as they move in utero, that shows that the baby's well oxygenated and that the neurologic system is intact. So that's what we're evaluating. Oh, the rationale got popped up. So that is um, so formula feeding frequency. How often do we formula feed? The answer's up on the screen because it didn't get put in there, right? But we breastfeed a little bit more frequently because infants that are formula fed are it takes a little bit longer for them to digest than breast milk. So formula feeding is every 3 to 4 hours, where breastfeeding is every 2 to 3 hours. So what are we checking for if we are doing an early amniocentesis? What are we looking at? So when we're checking an early amniocentesis, we are looking at for chromosomal abnormalities. We are looking for biochemical disorders, and I think that this question is slightly misleading as far as the amniocentesis itself is looking for the biochemical disorders, the chromosomal anomalies. The AFP levels are alpha fetal protein level is a test that's done around 16 weeks of pregnancy. And if you have a high or low level, that may be an indication that further testing needs to be done, and that may trigger the doctor wanting to do an amniocentesis or offering an amniocentesis. So, I mean, I would argue that they're not checking the alpha fetal protein levels when they're doing an amniocentesis, but they do use that to screen for um well, I guess they would test the fluid. So I guess alpha fetal protein testing of the fluid, because that is what they're using to screen. But the alpha fetal protein blood work is done at 16 weeks. You wouldn't be checking lung maturity because that would be a later amniocentesis if they wanted to check lung maturity because they thought that the baby might be need to be delivered early. They may check um, for lung maturity later. So alpha fetal protein levels in utero would be screened for neural tube defects. So chromosomal anomalies, biochemical disorders, and the alpha fetal protein levels, because the alpha fetal protein levels are screening for neural tube defects. All right. Check all that apply or select all that apply. Which are signs of magnesium toxicity? So the answers for this one is A, B, and D: respiratory depression, hyporeflexia, and weakness. Hyperventilation is not a sign of toxicity. In fact, a sign of toxicity would be hypoventilation or a decrease in respiratory rate. Stages of labor, select all that apply. So your stages of labor are dilation and effacement, delivery of the fetus, delivery of the placenta, and the recovery. So A, B, C, and D. Question 40 or 77, autism red flags. Select all that apply. Autism red flags. So the answers are A, B, and D. So no gestures by 18 months, loss of social skills, and no spontaneous forward phrases by age of 3. Leading cause of toddler injury. What is the leading cause of toddler injuries? And it's accidents. That's why home safety education is so important. Timeout duration, appropriate timeout length for a 5-year-old. The answer is B, 5 minutes. All right, question 80. Secondary enuresis. A child who was dry for a year begins wetting the bed again. The nurse should what? You have a child having secondary enuresis. The answer is C, assess for stressors or medical causes, because secondary enuresis is a sign of regression. So you would want to assess for stressors or medical causes. I think this is the last question. Um, incorrect SIDS teaching. Which statement is incorrect? All right. So the answer is D. You would want the baby to be on a firm mattress and place them on their back to sleep. No toys, blankets, pillows in the crib. And then the incorrect statement is bed sharing is safe if parents are light sleepers. So that was the last question. Did you guys have any questions for me or anything that you guys wanted to talk about? I am going to send this deck out and the recording. Um, but is there anything that you guys want to talk about? Well, I appreciate you guys um, working with me this term. And as I'm learning to teach, and I really appreciate it. You guys have a good afternoon or evening. And if you have questions through the weekend, just let me know. And I will see you guys on Monday. Bye, everyone.